this is task 50. We're going to be doing a dental prophylaxis. So the first thing we're going to review are our instruments that we've set up for the dental procedure. So first thing, dental speculum. We're going to be using this to keep the mouth open if we need to extend the mouth a little bit more than just with our hands. You definitely don't want to leave this in the mouth too long. It can cause definitely soreness when they wake up and some issues with the temporomandibular joint. So you don't want to leave this in too long. Other instruments here, we've got our mirror, which isn't typically used in veterinary medicine, our periodontal probe. So this is going to show us millimeter depths, pocket depths, and things like that. So on there you can see there's little you probably can't see it right now, but there's little grooves on there that can tell us how much of a pocket there is. And you definitely don't, for canines, you don't want it to be more than 3 or 4 millimeters. Our next instrument is going to be our explorers. So this can be used, there is no cutting edge on these explorers, so you can use them subgingivally to kind of feel around and see if there's any furcations or something like that. And then our next instrument is going to be our manual hand scale. So this has 2 cutting edges. This is going to be used to remove calculus, and it can only be used supragingivally. You definitely don't want to go under the gum line with this tooth. And then our next one is going to be our curette. So this one is used subgingivally, and it's used to get any kind of calculus or debris, maybe hair, underneath of the gum line. And then our next thing that we have here are calculus removing forceps. So this one can definitely cause a lot of mechanical trauma. So you only want to use this if there's large, like a clump of tartar that you can easily get off with these, just to kind of start the process of removing the dental calculus. The next thing we're going to look at is our ultrasonic cleaner. So this is an instrument used to remove tartar, and this instrument can actually be used subgingivally per the manufacturer. You don't want to leave this on a tooth more than 10 to 15 seconds per tooth. It can cause pulp damage and thermal heating, and it does also do some mechanical etching. So you just want to be careful with that instrument. It is less traumatic than the calculus removing forceps if used properly. Now the next thing we have is our tool that we attach our polisher with. So we've got the tip to polish the teeth, and then we've got our prophy paste. This instrument cannot be used for more than 2 to 3 seconds per tooth. It can cause pulp damage, and to reduce that you just want to use the lowest RPMs as possible, and you want to make sure you have a good amount of prophy paste on each tooth. This will also help smooth the teeth out at the end and kind of just polish them and make them look nice. The next thing we have in our instruments is our machine or our instrument that gives us water and air. You can use them both interchangeably or both together. And sometimes if you use them together, it helps get the prophy paste off a little bit easier, any kind of blood or anything like that. And this is our instrument that's going to be holding, this is our drill. So if we're extracting maybe a molar or a premolar, we can cut the tooth in half and remove it that way by drilling it. And our drill bits are right over here. And other things that we have right here are we've got a blade and some suture just in case we are going to do extractions. So moving on to our patient equipment and our personal protective equipment, we've got towels to put underneath of the patient's neck. This helps to where the patient can put its neck here and its head is kind of hanging off like this, so gravity kind of helps the water go out of the mouth and into the sink rather than back to the trachea. We've got our pharyngeal sponge. In this case we just use roll gauze and kind of dampen it and put it all together and put that in the back of the throat to cover the pharynx to catch any debris. And this is removed before the patient is extubated. The next thing we have is our mask. So this is going to cover our nose and mouth, and then our goggles are going to cover our eyes, our gloves are going to cover our hands, and then people with long hair, I think it's a good idea to use a net just so you're not getting debris in your hair and transmitting it to the patients all day. Also, it's also a good idea to change your clothes after a dental or wear something over top of your clothes. When you are doing a dental cleaning, the bacteria can get aerosolized and it can go into your mouth or your eyes or underneath your fingernails and transmit to your mouth later, and it can get transmitted to other patients that you see throughout the day. This is task 50. We're going to be doing a dental prophylaxis. So we've got our patient in lateral recumbency here. We can feel the prescapular lymph nodes, these submandibular lymph nodes here in the salivary gland. So you just want to palpate them and make sure that you don't feel any enlargements and no abnormalities with the neck. The next thing we're going to do is open the mouth and look at the soft tissue and the hard palate and the gingiva. So we're going to look here. She's got some tartar buildup here. Her mucous membranes look nice and pink. We can look at that hard palate and just kind of palpate that and make sure that you don't feel any masses or growths or anything like that there. You also want to look for any kind of lesions. And then you want to look at the tongue and just observe that and see if you see any burns, ulcerations, anything abnormal with the tongue. And if you look deep down in there, you can see the tonsils. If you move the endotracheal tube a little bit, you can see the tonsils and make sure that those don't look enlarged or look red or more red than they should. And then if you look under the tongue, you can see the frenulum and make sure that there's nothing going on with that, no ulcerations there. You also just want to look for retained teeth, any deciduous teeth that could be still in the mouth, because those can cause issues down the road. And then you also want to look for any deformed or fractured teeth, which I'm not seeing any fractured teeth here. So overall, it looks pretty good. It looks like, for the most part, this is just going to be a nice, easy dental cleaning. The next thing we're going to do before we begin the dental is we want to put in our pharyngeal sponge, which we have here, just some dampened gauze. We're going to stick back there to catch any debris and fluid that could be from the cleaning. And I like to leave a little bit hanging out so you can remember to take that out before we wake the patient up. So I'm just going to leave that hanging there. And we also have a towel underneath the patient's neck so that kind of gravity can help everything flow into the sink rather than back into the throat. And then we'll go ahead and start our dental. We're going to go ahead and use our calculus removing forceps. So we're going to place this part of the instrument, and we're only going to use this with like thick tartar. And you want to be careful with these instruments because they can cause damage to the gingiva and slab fractures. So we're going to put this part of the instrument on the tip of the crown, and we're going to put that just right there. So just using a swift motion, it just cracked that, like a pulling motion, cracked that thick piece of calculus off and actually took off all that. So that's all I'm going to do with this because, like I said, this can cause a little bit of manual trauma to the teeth. The next thing we're going to do is use our ultrasonic cleaner. So this ultrasonic cleaner, the manufacturer says that it's okay to use underneath of the gums, and you want to make sure that it is appropriate for that. Also, we're going to make sure we don't use this on any of the teeth for more than 10 to 15 seconds per tooth. It can cause mechanical etching and thermal heating and damage the pulp. So just using this parallel to the tooth, we never want to go put the tip to the tooth. And we're not going to put much pressure on this tooth. And now that I'm doing this one, I can kind of tell that this tooth is mobile. And that is our 103. So we'll write that on the chart here soon. And some of them, when the teeth curves, you just kind of have to go with that curve and make sure you're not putting the tip of the ultrasonic cleaner on the tooth itself. It can cause the pulp to heat. Okay. So we finished our ultrasonic cleaning. So now we're going to use our hand scale. And our manual hand scale has 2 cutting edges. You never want to use this subgingivally. This is just for supragingivally only. I'm just going to show you what I would do because this patient doesn't have any extra calculus for me to get off. I'm going to use the modified pin grip, and I would just do swift motions downwards. You start at the gingiva, start underneath the gingiva and go towards the crown of the tooth, and then you would just do that in swift motions using the modified pin grip, and that is what I would do. So we don't have to do that one. So the next thing we're going to do is use our curette. So this is our curette here. It does have a cutting edge. You always want to make sure you're putting that cutting edge to the tooth. So what I'll do, and this is for subgingival use, so what you do is you just kind of slowly go under that gum line there, and using swift motions, just getting any excess. You can get hair, debris, any calculus that could be under that gum line, and you're just kind of going with the curve of the tooth. Alright. We're going to go ahead and rinse the patient's mouth. So we want to do this by starting up here near the jaw, and we're going to go down. This also helps to keep and make sure that we are not spraying water into back where the pharynx is. We don't want it to go in the trachea and into the lungs. So we're just going to some water and go downwards. Alright, now that we've rinsed the mouth, we're going to go ahead and do our dental polishing. So with this polisher, you don't want to keep it on the patient for more than 2 to 3 seconds per tooth, because the polisher can definitely heat the pulp and be detrimental to the tooth. So we want to make sure we get some of our perfy paste, a good amount, because that will also help making sure that it's not going to overheat the tooth. We don't want to use the highest RPMs here. And we're just going to place it on the tooth. We'll do that little incisor. Make sure we have enough perfy paste to cover the tooth. Alright. So after that, we're going to go ahead and do another rinse to get all of the residual paste out of the mouth. Alright. So same technique here, we can use a little bit of air to kind of force the paste off, because sometimes that gets a little stuck on the teeth. So now that we've done our polishing, we need to do our post-cleaning oral examination, and we're going to chart those. So I can feel that 103 is mobile, so I'm going to write that in my chart. I don't see any hyperplasia, any oral masses on the gingiva, any caries, anything like that. Everything looks pretty good, and everything else seems stable. Just this 103 tooth, this incisor, is mobile, so we want to chart that in our chart, which is right here. So I'm just going to write here 103 mobile. And this is for the doctor. When we do our x-rays and everything, we'll write down all of our notes there. And then after that, we want to use our periodontal probe and just look for any pockets. Typically for a dog, the pocket depth should be around 3 millimeters. So for our, to measure these pocket depths, we want to just put the periodontal probe just like this and kind of just go gently. You don't want to cause any trauma to the gingiva. And that looks normal. And just kind of go all around the tooth. And these are looking to be about 2 millimeters. This one's about 3, which is normal. This one's about 3 as well. Alright, and then we'll also just chart that. If there were any pocket depths that looked abnormal, we would definitely want to chart that. And then after we've done that, we want to go ahead and rinse again, just in case you cause any blood. If you do touch a piece of, if you do touch the gingiva and it seems to bleed really easily, that's also something to note. And when you're rinsing too, you just want to make sure that you don't put the head upwards. Just keep it in its nice natural position because of the towel that we have here, so nothing goes in the trachea. And then after we finished our final rinsing, we want to definitely, if the patient is bloody or there's anything odd like that, we would want to clean the patient's face. And you could use, if it's blood, you use peroxide and just with a towel and just wipe their face. You definitely don't want to send the patient home with any kind of tartar in the fur or any kind of blood or anything that they didn't come in with. You definitely want to make sure that they're nice and clean for the owners, and that's it. So now I'm going to show you the diagram of the tooth and show you the different types of teeth. So starting with the maxilla, we have our 6 incisors here. 1, 2, 3, 4, 5, 6. We've got 1 canine. We've got 4 premolars, 1, 2, 3, and 4. And then on the maxilla, we've got 2 molars. And same on the other side for this. On our mandible, we've got our 6 incisors. 1, 2, 3, 4, 5, and 6. There's this little deciduous tooth. We're going to act like that's not there. We've got our 1 canine, and then our 4 premolars on the bottom. 1, 2, 3, 4. And then our 3 molars on the bottom of the mandible. 1, 2, and 3. So now I'm going to go over the surfaces of the teeth. So anatomically speaking, this is going to be your vestibule or your labial surface. And then this, if we were talking about the tooth here, this is going to be the, towards the root, it's going to be the apical surface, and then the coronal at the bottom. And if you open the mouth up, if you were looking at the maxilla, we're going to be calling this the palatal surface over here. So these surfaces right here are the palatal surface. And on the bottom on the mandible, this is going to be your lingual surface. So these sides here. And then also, but if you're speaking about the teeth, the space between the teeth is going to be your interproximal area. So these spaces here. And then if you're talking about the teeth too, you can use the terms mesial and distal. Mesial is more towards the nose, and distal is going to be more towards the back of the mouth. Now we're going to go ahead and do our dental formula. So I'm going to write it out. For canines have 42 teeth and felines have 30. So we're going to do for canines, it's going to be 2 times, because the left and the right sides. So for their incisors, each have 3. And then our canines each have 1. And then our premolars, there's going to be 4 on each. And then as far as on the top, we have 2 molars, and on the bottom we have 3 molars. And that equals 42. And then for our felines, 2 times. And then they both have 3 incisors as well. 1 canine. And then they have 3 premolars on the top and 2 premolars on the bottom. And then they both only have, they have 1 molar. So you add all this up and then times it by 2, and this one's going to equal 30. And that is the dental formulas for dogs and cats. The next thing I'm going to do is just go in a little bit more detail with my instruments on what I would do, just to show you my technique a little bit better. So we can see on this diagram that this patient has a lot of calculus. So we'll go ahead, and what I would do with my calculus removing forceps is stick this part of the instrument on the crown of the tooth and this above the calculus, and just use these motions here to remove the calculus. And then after that, I would use my ultrasonic cleaner just to kind of break it up a little bit more if I didn't get all the calculus. Also, we can use our manual hand scale, and you want to use a modified pen grip. And all I'm going to do is place this cutting edge towards the calculus and use just swift down motions to remove this calculus. And I would do that until the calculus is gone. And then after that, I would definitely want to use my curette. And this is going to be, this calculus removing hand scale is going to be used supragingivally only. This curette can be used subgingivally. So here I would just go with kind of, so say we're doing this tooth here, just kind of want to go under the gum line and keep doing these kind of curved motions here and getting the subgingival calculus and hair or any debris that could be under those teeth. And then afterwards, after we've polished and used our ultrasonic scaler, we would want to probe the teeth. And you do that by just placing the probe right here and going under the underneath of the gingiva, just gently, and seeing how much gingiva that you have. You know, if there's any detached gingiva, how much is the pocket. You don't want it to be over 3 or 4 millimeters in dogs. And then the next thing we're going to do is go over why dental x-rays are important. So dental x-rays are can be a very useful tool when we're looking underneath of the gum line. So we can see any impacted or retained teeth that have not erupted from the gum line. We can see any tooth damage, or any bone loss in the roots. You can also see the extent of periodontal disease. It's also a good idea if you're removing a root that's pretty attached, if you want to look at the x-ray, take a post x-ray and make sure that you got all the root out. That's a good way to use it as well. The next thing we're going to do is go over disorders. So I just have a little flow chart of the ones that I need to go over here. So the first one, calculus. Calculus is just the accumulation of plaque on the tooth. This can definitely cause periodontal disease. It can cause gingival recession. So if we do see a mouth that's got a lot of calculus, we would definitely want to do a dental cleaning and get rid of all that calculus to prevent any periodontal disease. The next thing is periodontal disease. So that's pretty much the disease of the tissue surrounding the teeth. And this is pretty much when the gingiva starts receding towards the apex of the root. You know, you're going to be showing more of the root, more of the tooth, and that can be very harmful. To prevent periodontal disease, you would do brushing at home, or we would do a dental here at the clinic. The next thing is fractured teeth. So anytime you see a fractured tooth, this can happen from dogs roughhousing or chewing on something that's too hard, things like that. You would definitely want to get that teeth removed. It can cause infections, enamel hypoplasia, things like that, and the tooth definitely needs to be removed, and it can be very painful. The next thing we have worn teeth. This is just caused, we see it a lot in our geriatric patients when they just like to chew and chew and chew on toys, bones, anything. And this can be harmful if they have a recent worn teeth where the pulp is exposed. That can cause infection. It can also be painful at times. So those are definitely good to probe during your dental. And then retained deciduous teeth, we'll see those a lot in our puppies that come in for spays or neuters or kittens. Retained deciduous teeth can definitely become an issue because it causes the adult teeth to come in improperly and cause crowding of the mouth. Also, it causes a lot more crowding, so there's more dental calculi that can accumulate on the teeth, which can cause periodontal disease. So those teeth definitely need to be removed. The next thing, tooth root abscess. This can be caused by trauma or just, extended periodontal disease, really chronic periodontal disease. This is pretty much when there's a big infection in the tooth root. So the apex of the tooth, there's a nasty, there's pus, bacteria, all kinds of things in there. And this tooth needs to be removed if it has not fallen out yet. And there needs to be a course of antibiotics to help clear up any infection. And obviously there will be some sutures involved with this to close up the gingiva so there no other bacteria or anything like that can get in there. The last one is oral nasal fistula. So this happens when the bone between the tooth and the nasal cavity pretty much disintegrates. This can be very detrimental. So what you would do in this case is remove the tooth. If it's still there, you would want to close that site up. You can't really do any bone reconstruction, at least we don't do any of that here, but you will close that gingiva up to make sure that no debris, just like the tooth root abscess, gets in there. This will cause a hole from the tooth to the nose. So dogs with this you'll see bloody noses and things like that. So the next thing we're going to do is go over home care instructions, which I have here. So the patient we did earlier, Chloe, these are her home care instructions. So when we did extract that 103 tooth that I was saying that was mobile in our post-cleaning exam, we did actually extract that tooth. So we're going to just say that the owner should probably take it easy and feed soft food for the next 2 weeks. That's what the doctor recommended. So what we're going to recommend is that they just wet their normal dry food and just let it sit there to prevent any diarrhea or anything like that. She is going to get some medication to go home, so we want to go over those instructions with the client and make sure that the patient's going to be getting the appropriate dosing of the medication. We're going to recommend that once that site is healed, maybe in about 2 weeks, to start brushing. It's really, really important, or else that dental calculus is just going to accumulate right back up. So we want to educate our clients and tell them that they can start just introducing the toothpaste to the patient's mouth. You can use your finger for a little while just to get the patient comfortable with you being in their mouth, and then introducing the toothbrush and maybe not doing so much of brushing but just having it in there and them being okay with it. Then you want to start with your brushing. You want to just tell the clients to do nice oval motions, more towards the crown of the tooth, not so much at the gingiva. And this needs to be done at least once a day is what we recommend. If they're just doing it once a month, it is important to tell them, it's probably not going to prevent anything or change anything if you're just doing it once every 3 months or so. The next thing is toys. You can tell them, educate them about certain chews and those types of things that can be beneficial. So here we have Oravet chews, and they have an enzyme in them that helps break down tartar and prevent it from building up. And then there's also that mechanical action with the chews that you want to just educate that definitely helps. The mechanical plus the enzymes is a good way to go. There's also supplements like Perisupport, Oravet, and those types of things. And then also just feeding a hard food is better than feeding soft food for all their diet, because they get that mechanical action against their kibbles rather than just eating the soft food that just sits on their teeth. And that is it.